Hi everyone, I'm Dr. Darria Long-Gillespie. Call me Dr. Darria. I am here with ShareCare for ShareCare Live on Facebook. Every Tuesday we'll be answering your questions at 2 p.m. Eastern Standard Time, and we will answer the questions submitted from last week's comments in last week's Facebook Live session that we did. So make sure if you have any questions, put them down there in the comments. Of course, we wish we could answer every single one of them. We'll do our best to answer as many as we can, and knowing that we can't get every single one of them, we have so much great information on ShareCare. Go to sharecare.com to get the rest of your questions answered. There you can also take the Real Age test and sign up for any one of our many awesome challenges that we have and get great health information. So let's dive into some of last week's questions. Now, our first two questions, I want you to know, we answered two of them. One from Renee DN on, do you consider a paleo diet healthy? And the next one from Himana CG on, when a woman takes birth control for years, can she become infertile? Ladies, we covered both of those. I want you to go to sharecare.com/RadioMD, look for the Ask Dr. Darria session from today's radio show, and we answered both of those there. So make sure you go there, you can get your answers there. Today we're also going to be talking about diabetes. We're going to be talking about psoriasis treatment and all sorts of other things to make sure that we get to your questions. So our first one, Allison O said, I would like to know about diabetes and if a person can get rid of it for good. Allison, I am so happy that you asked this question because I have so many patients, and it makes me so upset because they think that since their mother had diabetes or a sister had diabetes type 2, that it's going to be inevitable for them and this is the way their life will be forever. And that's not the case. That is the great news about it, is that weight loss and exercising truly improves your sensitivity to insulin and improves that insulin resistance you get with diabetes, and also improves the insulin secretion. So how much? I am not saying you've got to become Gisele Bündchen to be able to control your diabetes. It doesn't take, actually, it takes a lot less weight loss than many people think. 5 to 10% of your initial body weight. That's going to be just enough to improve your sugar, your lipids, your blood pressure. One randomized controlled trial showed that when people lost 8.6% of their weight in 1 year, 8.6%, we're not talking a whole lot here, they improved all those metrics. They improved their diabetes, their blood pressure, cholesterol. They were able to go on fewer medications overall. Their HbA1c was better. So absolutely you can affect your diabetes. Now, I'm not saying go off all your meds because you're going to focus on weight loss. Keep on your medications while you're also going on a great weight loss regimen at the same time. Aim for 5 to 10% over the course of a year and at least 30 minutes of moderate physical activity every day. Now, if you have trouble getting that in, we have some great challenges at sharecare.com. Go to them. We have our 10,000 steps a day challenge. We have our 30 days to running a mile, because you can do that. And you'll get some great guidance on how to do that. And aim for 3 to 6 pounds in the first 4 to 6 weeks. We're not talking a huge amount, but you will see over time your diabetes will be better controlled. You can eventually potentially go down on your medications and truly change your life. So our next question was from Angelina H. And she asked, what does it mean when your potassium is high and what can you do about it? So Angelina, this is a question in the ER. I see a lot of patients with high potassium. And for most of us, when you have healthy kidneys, your kidneys get rid of the potassium. It doesn't really matter how many bananas you eat in a given day. For the rest of some people, they have problems with their high potassium, and that's usually due to two things. One is you're on a medication that can raise your that can raise your potassium, and that's often medications like spironolactone or ACE inhibitors or ARBs, angiotensin receptor blockers. All of those can raise your potassium. Even other medications like digoxin, some beta blockers, and some NSAIDs can raise your potassium. So first of all, inquire with your doctor if you're on any medication that could cause it to do that. A second reason is because maybe your kidneys, if they're just struggling a little bit to get rid of all the potassium, it's a sign of some kidney or renal insufficiency is the word we talk about. Symptoms you may start to feel with your high potassium, you may start to feel just a little bit weak. It usually kind of starts in the legs and moves up into the body and arms. At very high levels of potassium, it can be very dangerous too. So I want you to take this seriously if you are having high levels of potassium. So number one, if you are, talk to your doctor if you're on any medication that could be causing it to be high. Number two is to focus on your diet. So you have to avoid some foods that are high in potassium, some whole grain breads, bananas, peanut butter. I love peanut butter, so cantaloupe, honeydew, kiwi. You can go online and find some great information for foods that are high in potassium. Search it on sharecare.com and you'll be able to find some things. And then stick to foods that are more low in potassium. Now, that could be a variety of things that like low potassium foods: apples, pears, blackberries, green beans, cabbage. Some foods actually can be low in potassium if they're cooked, like carrots, but are higher when they're raw. So I don't expect you to memorize all of this. Go online, you'll be able to find great information. Lastly, if it's because your kidneys are truly having trouble, talk to your doctor. They may need to put you on a different blood pressure medication to help lower your potassium, or at least not make it high, and make sure that you're optimizing the blood flow to your kidneys to keep them in shape for the rest of your life. All right, our next question is from Doreen WN. She said, what should a person who has Crohn's not eat? So Doreen, you have my empathies. Crohn's is a really complicated condition, I know. It often requires various medications. Many patients end up going through a lot of surgeries and a lot of chronic pain. So I'm sorry that you're going through that. And I want to talk about what things you can do to help your Crohn's. Now, there are indeed some lifestyle and disease modifications you can make. For most people, it doesn't mean they can just come off their other medications for their Crohn's, but it can help you feel better and may reduce the frequency of your flares. So I don't want you just to come off your medications. I want to help you do all of it together. So, foods, when we talk about diet, it's important to know that foods themselves don't really worsen the inflammation of Crohn's, and that's what Crohn's is. For everybody else out there, Crohn's is inflammation of the entire intestine, essentially from your mouth all the way to the end of the large intestine. So it can be an incredibly challenging condition from that standpoint. Now, foods don't worsen that inflammation, but some foods may aggravate it, or they may be harder to digest, or they may cause worsening symptoms. So let's talk about that. And number one, what I'd like you to do, since all the foods can be different from one person to another and the reactions to them, is to keep a food diary. Write it down, especially if you're having a lot of flares. Keep a food diary, what you ate, how you felt when you had a flare. From there, you can start to recognize patterns, because what may set off one person, make them have a worsening Crohn's flares, or just make them feel worse in general, may not matter to the next person at all. So keep a food diary. If you start to see any patterns, I want you to consider an elimination diet. That means you go off that food for about 4 to 6 weeks and see if it helps your Crohn's at all or helps your general symptoms. You can do that and see if it really is the trigger and if it's helping you to avoid it at all. A couple of different triggers for many people, or not triggers, but things that can make them feel worse. Dairy is one of them, and that's especially if you're lactose intolerant. That's because the symptoms of lactose intolerance may mimic the symptoms of Crohn's at times on a much less severe basis, but they may cause you to have the same pain and other symptoms. That it's important to try a lactose-free diet for a little bit if you can. Next is to watch for foods with high fiber. I want you to eat plenty of fiber. I'm not telling you to avoid those great foods, but some of them may cause cramping if they're not fully digested in the smaller intestine. So we're talking some of the fruits and vegetables and whole grains, and some of the vegetables that may make it even harder, like those in the cabbage family, broccoli, cauliflower. Those can all be a little bit harder to digest, so watch them. Again, in your food diary, pay attention to that. Of course, in general, just some general tips. Drink plenty of fluids, because people with Crohn's may have difficulty in the large intestine reabsorbing water, so they may become more dehydrated. Stick to smaller meals that may make it easier for you to digest and less severe cramping, because you're just having smaller boluses of food. Reduce foods that are greasy with really high fat, because people with Crohn's sometimes have difficulty absorbing that, and that can cause you to have some really bad symptoms when it comes out the other side. And then lastly, talk to your daughter about a multivitamin. A lot of people with Crohn's have difficulty absorbing all the nutrients that they need, especially a lot of the fat and soluble vitamins, calcium, a variety of different ones. Talk to your doctor. They may recommend that you go on a multivitamin. Check with your gastroenterologist for all of these, and you'll be able to find that you can get on a good, hopefully the best for you regimen for Crohn's. Now, our next question is an interesting one from Mervat T, saying, do antiperspirants cause skin cancer? So Mervat, I think what you're talking about is the philosophy that I've heard in the past about antiperspirants causing breast cancer. If you did mean skin cancer, there really aren't any connections with antiperspirants and skin cancer, so you can feel rest assured about that. Let's tackle the one about breast cancer. So no, there is no evidence that antiperspirants cause breast cancer. This came on, I think, in the 90s and the early 2000s, and people were talking about the lymph nodes in the underarm area need to be able to drain toxins from your blood, and that the antiperspirants keep those lymph nodes from being able to drain. Doesn't make sense because your lymph nodes are separate from the sweat glands in your underarm. So there's no tie there. There's no connection with the antiperspirant and breast cancer. Now, there is a second issue that's not about blocking the sweat, but also about the ingredients in antiperspirants. Now, those are aluminum and parabens, are two of the ones that people mostly talk about as the villains and the potential ones causing cancer. I understand that concern. There's really, again, not sufficient evidence to say that this is something we need to work on or to be eliminating. We know that as far as those go, those are a much lesser factor than other important lifestyle things you can control, such as weight or smoking or alcohol that may impact your risk of breast cancer. However, if you're concerned, you don't have to go off antiperspirants altogether. The rest of the world will thank you. But you can look for those that may be without aluminum or parabens. And again, there's not evidence saying they're bad for us, but if you're concerned about those two, that would be one way to keep your antiperspirant and get rid of the concerning ingredients for you. Then let's see, I think we have time for a couple more questions. Let's see, Hal J says, can we talk about reading labels, not just calories and carbs, but also chemicals? So Hal, you just asked for a question that we had just posted recently on one of our blogs here at sharecare.com that I had written about. And there's two things I want to talk about. We can get into the chemicals on a later one because that's a great question. There are so many chemicals on foods now, and as a mom myself, I look at them and think, what am I putting in my child? And as a general rule, if a food has a bunch of things that I can't read as a physician, I don't give it to my daughter. The fewer ingredients, the better, especially when you're talking about kids. There are two things I want to talk about, though. You've probably heard a lot about them, but they're so important, we got to repeat them. And that is sugars, and that also is trans fats. So sugars, we eat so much. If you look at the American diet today, over half of our calories are from refined grains and sugars. So I want you to look at your ingredients. If they have any of these things in the first 5 ingredients, then this food is a candy, it is a treat, which is fine. I like candy and treats every once in a while, but it's not a true food nutritious group. So that means corn sugar, corn syrup, dextrose, sucrose, fructose, anything ending in ose, whether it's high fructose corn syrup or just regular old fructose. If it ends in an ose, it's sugar. If that's in the first 5 ingredients, the food is a candy, it's a treat, should be used sparingly. And then the second ingredient is the use of trans fats or partially hydrogenated oils. Now this is an area that, let's be honest, the lobbyists have kind of won here on the labeling. So partially hydrogenated oils are still allowed in our foods. The food may be marked as trans fat free, and that's if it has less than 0.5 milligrams of trans fat or partially hydrogenated oil per serving. That still adds up. So look in the ingredients. Even if it says trans fat free, if you see partially hydrogenated oils in the ingredient, avoid it. There's no good to having that in your diet. It's a good thing to leave out. So many other questions. We didn't have time to go through all of them. We try to answer as many as we can here on Facebook Live, on ShareCare Live. Ask your own questions in the comments. We will answer as many as we can on ShareCare next week. And of course, anything we miss, go to sharecare.com to find all your answers. This is Dr. Darria. Thank you for joining us.